Um, Another important point about the BMI here is that if we do the same operation done by the same surgeon at the same hospital in a BMI of, let's say, 35 versus BMI of greater than 50, the risk is much more with a higher BMI. That's another rationale for why wait till you get to the supermorbid obese category. Many factors influence obesity. We talked about this. It's a combination of genetic, environmental, behavioral, and that's why we need to kind of address all these factors as we evaluate and treat the patient suffering with obesity. The serious illnesses associated with obesity that I referred to earlier, known as comorbidities. It's a busy slide because the list is long and it's not even a complete list, but most of the common ones are listed here, such as type 2 diabetes, hypertension, hyperlipidemia, respiratory disease, sleep apnea, depression, menstrual irregularity, infertility linked with menstrual irregularity. So polycystic ovarian syndrome is a very common cause of infertility in young females, and it actually predisposes them to develop diabetes and the metabolic syndrome, which is a combination of diabetes, high blood pressure, etc. And to think that there is no real cure or treatment for polycystic ovarian syndrome right now, patients are put on oral contraceptives to regulate the cycle. That does not address the underlying cause. And we know that hormones such as estrogen like to sit in fat. So you can imagine that the more the fat tissue, the more the hormonal imbalance can happen. And therefore, with polycystic ovarian syndrome, one of the key ways to treat that underlying problem, which can lead to infertility, is to address obesity. Moving on, urinary stress incontinence, asthma, cancer. A lot of the people do not associate cancer with obesity, but the list of cancers that are linked with obesity is long, and some of them are pancreatic cancer, esophageal cancer, and the incidence of cancer related to obesity goes up every year. And unfortunately, a lot of the even the medical community do not make that association. Gastroesophageal reflux disease, known as GERD, or in simple terms, heartburn or reflux, is also associated with obesity. Degenerative joint disease, heart disease, gallstones, fatty liver disease. Fatty liver disease is now rapidly replacing are rapidly becoming one of the more common causes of liver failure. What it does is that the adipose tissue replaces active liver cells, and hence the percentage of liver cells that are actually doing the function go down, and hence the liver function starts to decrease, and that can progressively lead to cirrhosis and liver failure. And those who know how liver failure can affect somebody's life, it's just very important for me to get this message across that obesity is linked with fatty liver disease, and taking care of obesity at an earlier stage before liver cirrhosis steps in would be the way to go. Coronary artery disease, stroke, osteoarthritis, and infertility we talked about. You are not alone. More than 68% of the adults in North America are overweight, 40% are obese, 25% of children are overweight. I would hope that if you refer to the BMI definition, you would know that overweight, obese, and morbidly obese are not the same things. 25% of children are overweight, and that's a very alarming number, because what we know of the disease that is progressive and lifelong, we are essentially raising a whole generation of children who are going to feed into potentially the supermorbidly obese category, which is, as just to recap, associated with more severe medical conditions, and hence will take a toll not just on the financial cost, but overall their life expectancy and their productivity as adults. 14.3% of adults in North America are currently morbidly obese. The total medical cost for obesity in 2011 was $190 billion, and we all know that as a nation we can't afford to have such a high cost. 325,000 obesity-related deaths occur annually, and that is from 2006, so I'm sure right now it's even higher. Obesity trends among U.S. adults. This is the map of North America. The reference is CDC, so Center for Disease Control. Any one of us can go online, look up the CDC maps for obesity and get this information. What I just want to highlight is the year on this slide is 1985. The map of North America, and the colors, as the colors get darker, the percentage of people living in these states that are suffering from BMI greater than or equal to 30 go up. So the next few slides, they are all 1 year apart, and notice how the colors change. So on just 1 year gap, the percentage of people living in the states with BMI greater than 30 is rapidly going up, and as the color gets darker, as I said, the percentage of people go up. As you can see how fast this has spread, hence it deserves the title of it being an epidemic, and that was the rationale of me coming up with the title that we really need to unite in the fight against this disease because it's spreading too fast. The daily challenges of the obese, this is more just to refresh everybody's memory, and also to reassure people who are suffering from this disease that we are aware of the daily challenges that you have to go through, whether it's seating in public places, the steps, the looks that people give and people get. This is not anybody posing for this picture. This is a picture that I received from one of my team members, and we are all guilty of receiving or getting these looks, and that feeds into the psychosocial impact of this disease, and hence to depression. High BMI can affect life expectancy. We know that teens entering adulthood with BMI greater than 40 die 8 to 13 years earlier than general population. And that's an alarming fact. 8 to 13 years earlier. We try so many different measures in terms of treating other diseases just to get few more months, few more years added to the life expectancy. And here we know that obesity can easily take off up to 10 years from the life expectancy, and this data has been around now since 2003. Let's face it, it is part of our culture. We have to take the onus, the responsibility of getting to this point. There's an imbalance between caloric intake and energy expenditure in our culture. The supersize phenomenon. Regular size McDonald's meal is 600 calories. Supersized McDonald's meal is 1800 calories. I'm not against McDonald's. I just took that as to symbolize our eating habits. So if you can imagine the amount of time it takes for any one of us to gulp down these meals, and then the amount of time it takes for us to burn these calories. So 45 minutes of exercise in a 154-pound person, 330 calories bicycling, 700 calories running, 180 calories walking, and 230 calories dancing. I sometimes run on the treadmill, and I can never make it close to 700 calories running on a treadmill. So whoever this person is running is clearly doing a much better job than a lot of the other people can do. But the take-home message from this slide is that it's easier to add in calories, very difficult to burn those calories. So you have to be careful with what you put in your mouth. I'm going to let the pictures speak for themselves. I am not against food. It's the message of this is not that stop eating. I think food is a blessing from God. It brings families together. It's an important part of our culture. The most important thing is to make the right healthy choices.